So let's take a look at this model, which is going to show you the layering of arteries and veins. If we look at the artery, which is this pink structure here in the middle, and then we've got a vein on either side of it. So this artery has blood represented with red in the middle that would be flowing, actually it would be flowing in this direction based on the way the valves are oriented in the veins. So blood flowing this direction. In contact with that blood is endothelium, right? And then just outside or superficial to the lumen from there is a subendothelial layer, or subendothelium. Right here is kind of bluish tan color. Wrapped around that subendothelial layer is an internal elastic membrane, followed by the tunica media, or the smooth muscle portion of the artery. And then for this artery, around the smooth muscle is an external elastic membrane. And then finally, the whole artery gets wrapped in adventitia, which is this. Veins are slightly different. So the artery has no valves anywhere through there, but if we take a cross-section of the vein, you can see that it does have valves, which is going to force blood to flow just in one direction. If any blood was trying to push this way, it would close the cusps on this valve and prevent it from flowing backwards. That's helpful because there's not nearly as much pressure in veins as there are in arteries, so the pressure gradient really helps things flow easily in arteries, whereas with veins, we rely on skeletal muscle contraction to kind of milk the blood back towards the heart. Layering, veins still have an endothelium and a subendothelial layer. They still have the internal elastic membrane and a tunica media, but they lack an external elastic membrane. So you'll notice this layer, which is on the artery, is not present on the vein. Also notice that the vein's tunica media, that smooth muscle, is much thinner than it was on the artery. And of course, it still has an adventitia to wrap the whole thing.